Hi, I'm Meera Riner, and I'm the Chief Operating Officer with Nexion Health. We operate 42 skilled nursing and one assisted living facility in the states of Louisiana, Mississippi, Texas, and Colorado. Our corporate office is based in Sykesville, Maryland. We support over 3,500 residents and employ over 4,500 employees across our various locations. Through the COVID crisis, VoiceFriend became introduced to us through people in the industry. And after attending a demo of VoiceFriend and learning about all the capabilities, we implemented it in our facilities in the month of May to really become a solution to help us enhance our communication with our families as well as our employees, to whether it was comply with regulatory mandates or just keep them informed since they were unable to physically visit our facilities. Since May, we have sent out over 2,100 voice messages to our families and employees, and it has allowed us to have the ability to outreach to over 500,000 recipients, which would have been simply impossible for us to do if we had to rely on somebody contacting each person. Probably what's been amazing for us in this VoiceFriend journey is not only did we utilize VoiceFriend to tell our families and employees about our COVID cases, which was a regulatory mandate and requirement, but we also just kept them updated about changes that came up, such as new rules and regulations about visitation, or maybe the facility had a change about how meals needed to be delivered, or maybe we needed to let our employees know about new COVID benefits that were being offered. As we've done all these amazing things, we also have used this COVID pandemic time to survey our families to get feedback on how did we do with communication during this pandemic. And I'm excited to share that they actually rated 88% of our over 1,100 families who took the survey said they were greatly satisfied with the level of communication, which we primarily attribute to our use of VoiceFriend. And they specifically gave examples of how they got daily, weekly updates and were very satisfied knowing what was going on, especially in a time where they were not able to come into the facility and yet had sensitivities about knowing how busy the staff in the nursing homes were and not being able to talk to them as frequently as they might have previously done. So that's been wonderful for us, and we look forward to continuing to enhance our use of VoiceFriend. Particularly something that I'm looking forward to is twofold. One, really working on the activity side and enhancing our use of VoiceFriend in our assisted living communities. And so we're looking forward to making that a goal for the fourth quarter. But also, because we know that there's such a challenge with readmissions and rehospitalization for residents who discharge from our communities, we look forward to partnering with VoiceFriend and using that technology to be able to reach out to residents post-discharge, to be able to check in on them and use the technology to make us more efficient and resourceful so we can mitigate the readmission to the hospital and meet all of our goals in that area as well.